Hi everyone, I'm Christina Feltner, and I completed my case study on cerebral palsy. Cerebral palsy is the most common cause of disability among children worldwide, and it is defined as a condition consisting of a group of disorders, possibly involving brain and nervous system functions that deal with movement, learning, hearing, sight, and thinking. Cerebral palsy is the direct result of damage to the brain that occurs before, during, or after birth. Movement disorders, difficulty eating or swallowing, varied muscle tone, ataxia, and poor fine motor coordination are all common with individuals with cerebral palsy. Boys are more often affected than girls, 1.35 males to every 1 female. There are 3 major types of cerebral palsy. Spastic, which comprises of 70 to 80% of all cases, athetoid, ataxic, and then we also have mixed. Spastic cerebral palsy is characterized by rigid movement and hypertonia. Individuals with athetoid cerebral palsy demonstrate involuntary muscle movement and decreased tone. Ataxic cerebral palsy is characterized by incoordination or ataxia, as the name suggests, and mixed cerebral palsy is a combination of at least 2 of these types. So why are there so many different types of cerebral palsy? The various types of cerebral palsy are due to the area of the brain that has sustained the damage. Spastic cerebral palsy has damage to the motor cortex. Athetoid cerebral palsy is damage to the sympathetic or parasympathetic portion of the brain. And ataxic cerebral palsy is caused by damage to the cerebellum. Diagnosing cerebral palsy often occurs during well-child visits. Children under the age of 2 receive well-child visits every 3 months. They demonstrate an inability to hold their head upright, their legs become stiff when they're lifted from the ground, or they have an overextension of the head. Children often demonstrate difficulty crawling, and their developmental milestones are not met on time. MRIs and EEGs are completed, and children are sent to see the neurologist. So how do we treat cerebral palsy? It's important to note that cerebral palsy is not progressive, and treatment is aimed at preserving function. Vision, hearing, and speech are often impaired, and comorbidities such as epilepsy occur. Motor impairments are addressed by physical and occupational therapy, and surgery is completed to reduce spasticity. Occupational therapy interventions. Occupational therapy practitioners focus on fine motor coordination, range of motion, bilateral integration, strengthening, increasing participation, executive function skills like memory and organization, preserving skin integrity, and the use of assistive technology. Assistive technology is any item, piece of equipment, or product system, whether acquired commercially, off the shelf, modified, or customized, that is used to increase, maintain, or improve functional capabilities of a child with a disability. Occupational therapy practitioners play an important role in the use of assistive technology. We recommend high-tech and low-tech devices. High-tech devices would be computer programs, and low-tech devices could be any type of utensil used for feeding, anything simple like that. We also make wheelchair and seating recommendations. Some of the alternative treatments for cerebral palsy are acupuncture, hippotherapy, aquatic therapy, dance therapy, and massage therapy. The risks for cerebral palsy are low birth weight and preterm labor. Therefore, in order to prevent cerebral palsy, promotion of good prenatal care, vaccination for the mother, and good hygiene is important. Increased awareness regarding prenatal care, early intervention, speech, physical therapy, and occupational therapy, and providing resources for caregivers is very important. The most common cause of disability in children, cerebral palsy, is a lifelong disease. With proper interventions and supports, individuals can lead a productive life. Thanks for listening to my case study, and I hope you learned something about cerebral palsy.